Okay. All right. Hi, good afternoon, everybody. So before we start, why don't we start with attendance taking? So can I know if Miss Ziwei is around?
Yes, I'm in.
Okay. Then for Miss Lily.
Yes, I am.
Okay, thank you. So there'll be 2 person in attendance uh for our lesson today, for our workshop today. So I will start with our first opening question with everybody here. So may I know what are the communicable diseases you know of? Is there anyone who has any idea what are non-communicable diseases? Would there be anyone from the floor that will be able to share with us? Miss Lily, you can turn on the microphone.
Maybe diabetes.
Okay, that's one of it. What about Miss Zue?
Heart disease.
Okay, that could be one of it as well. So, all right. So at least you guys have a rough idea of what may or may not be non-communicable diseases. So, before we start to talk more in depth regarding our discussion today, I'd like to share with you a story that is very dear to me, so that you know why I find it so particular that we need to understand non-communicable diseases and what the things that it can cause to our life. So personally, I know of somebody who is very dear to my family, who who has been very well, very healthy, but then they seem to think that they are healthy, but actually a lot of times they didn't really take care of what they drink. So he was such a fantastic person, such an important person in the lives of my family. But because of his habit of drinking teh tarik kau every day, over the years, he started to develop diabetes. And not before long, he started to have issues with his circulation. Then we found out that his foot has diabetic foot ulcer. Eventually, he has to go through amputation. Somebody who had been such a cheery person in the life of our family, one day, uh, together with his foot being cut off, the smile went away. And then over the years, he started to become someone who is very moody, very unhappy. And then at the age of 60, he passed away because of complication. Just because of his diet, just because of the way he take care of himself, not understanding the importance of taking care of his own body and what are the diseases that may affect him. He was someone who is so important to our family, but one day it all just went away. So because of that, I made it a point for me personally, to share as much as I can to as many people as possible regarding the importance of non-communicable diseases and ways to prevent them. Because I want to make sure that we are able to keep the person in our family, in our social circle, being able to continue on with their smiley face, with their cheery personality, and being such a wonderful person to everybody around them, just by being healthy. Because a lot of times, that is one of the most important thing in our life, and for us to continue. So this is why I would like to share with every one of us here today. Do we want to keep the person around us healthy, or do we want to keep ourselves healthy? Because so that we can continue being happy, being a positive outlook to everybody around us. Because most important is all about health. So why don't we all make sure that we really pay attention today to really know how can we keep ourselves healthy. So before we start, let us explain a little bit regarding class rules. So first and foremost, I would like to share that to remind everyone to keep their phones silent, because we want to make sure that we make use of the full amount of time that we have today to have full concentration, and to make sure that we retain as much information as we can for our session today. And we should be on time. Should there be any breaks in between, let us come back on the same time as we have decided. And should there be any notes taking, please do prepare your own stationaries. But most importantly today is that we want every one of us to adopt a special character, that is to be eager to learn and be ready to learn, to make sure that everything that we share today will be able to be absorbed and put into use in our daily lives, because there's no point in hearing about information and not analyzing it and retaining it and use it for our own purpose. And last but not least, let us keep the training room clean, wherever you may be. Let us make sure that we have this cleanliness section settled. All right. So let's do a simple ice breaking. So can I have our participant to introduce yourself? Would Miss Lee will be interested in sharing with us your name, your age, and why do you think you would like to join in on this workshop today?
Okay, I'm Zilay here. Why I'm interested is because I wanted to know more about what you said, it's like know more about the information, and you can actually help to maintain a good health in the family members.
Yep. All right. Thank you very much, Miss Lee. What about Miss Lily?
Hi, I'm Miss Lily. Why? Because I want everyone around me is healthy.
Fantastic. You haven't shared with us your age.
Oh, I'm 28 years old.
All right, fantastic. Thank you, Miss Lily, and thank you, Miss Lee, for sharing with us the reason why you would love to join in today. And it's truly something that we really ought to make sure that we have, is the knowledge to keep ourselves healthy. So a lot of times we have this issue because we believe that we are young, so we don't have to know what's going on with our body. So let us make sure that we are able to understand simple, non-communicable diseases that actually is very prevalent amongst our population here in Malaysia. But before I start, since that you have already introduced yourself, I would love to introduce myself with every one of you today. So let me start our chronic disease prevention training today, where our main focus is to make sure that we understand chronic diseases that is prevalent amongst our population and ways to do prevention, so that we are able to prevent such diseases in our lives. So let me introduce myself. My name is Dr.Nah. I'm a medical doctor with 8 years of experience in the medical field. In the past, I've worked in government sector for the past 5 years, and subsequently currently in the private sector for the past 3 years. I have furthered my studies in functional medicine in Malaysia, and is an associate member of the Association of Nutritional and Functional Medicine Practitioner Malaysia, as well as certified occupational health doctor with Malaysian Aesthetic Certification Part 1 as well, with a special interest in regenerative medicine and integrative medicine, where it's all about preventive and prevention and anti-aging. so that we can really live a long and healthy life ahead of us. So today, this is the content that we will be sharing. We'll be discussing what is non-communicable diseases, why does it matter, how does it affect us. We'll be doing some simple activities, and what can we do with heart healthy activities suggestion. We'll do some case studies and a little bit of policy brainstorm amongst our Q&A section today. So the whole session will roughly take about 2 hours for us to get to know more and more regarding our current our information that we'll be sharing today. So most importantly, I would like to have a two-way communication with our participants so that should there be any question asked to the floor, I would love for there to be a response from both the floor and myself as well. And we will be having a question and answering section at the end where we will discuss in further details. Should there be any more information that wasn't informed here in the session, I'll be more than happy to refurnish with more information then. So let us get started with our first part, where we'll be sharing what is the definition of communicable and non-communicable diseases. So we will do it simply from the first part about communicable diseases. So most importantly, we should know that communicable diseases means diseases that can be spread in the population, be it in your family, your social group, or your whole group in your surrounding area as a whole. So they are also known as infectious diseases. They are illnesses caused by pathogen. Pathogen meaning to say that it's a vector, something that can pass illnesses such as bacteria, viruses, fungi, and parasites. So this could be example for your gram-negative bacteria, all these bacteria that streptococci, these are all bacteria that can be spread through your cough, your sneezes, your touch. The same way could be said regarding viruses, fungus, and parasite. A lot of times we will get fungal infection through spores, inhalation. It could be fungi infection through your moldy paint job in the house or old buildings. This could be a form of communicable diseases, like places where the paint is not antifungal, where because of the damp condition, fungus will develop and then they will release spores. Then it can go into our body in the form where we will come out as candidiasis and so on and so forth. And these diseases are actually very prevalent in our surrounding if we do not do the necessary precaution. Why? Because we are in a tropical environment here in Malaysia, because of the seasonal rain, constant rain, our humidity level is actually very high. So fungal infection is more prevalent. It could be in the form of lung diseases. It could be in the form of skin diseases as well. And also through the food that we take. Because a lot of times we expose the food to the spores, we'll eat it and it will have fungal infection in our abdomen as well, in our stomachs. So fungus is something that we really need to pay attention to. Then we talk about parasites. Parasites could be diseases where, because of cleanliness, a lot of times we eat through our parenteral route, which is we eat parasite that is in our hand, on our hand during the food preparation when there's not proper hygiene control. So all these communicable diseases, most of the time they will have bacteria, they will be antibacterial medication, which is our antibiotics. They're able to sort out this issue. Viruses, some viruses will have antiviral medication. Fungus, we have our antifungal, and parasite, we have albendazole, all these anti-parasitic medication. And these communicable diseases typically will have a very rapid onset, such that when we develop symptoms, it's the point where we are very infectious. We can spread amongst each other. Notably, the most famous ones thus far is our COVID virus. These are considered communicable diseases. So what are the effective prevention measures that we can do? I'm sure all of you are very well aware regarding vaccination right as of now. Because of the exposure to COVID vaccination programs, the general publics are getting more understanding and know-how regarding vaccination. Vaccinations are very, very effective against viral infections, and hygiene practices can help us cut down the communication of such diseases tremendously. So a good hygiene practice will include mask, okay? Proper certified masks such as N95 will be able to eliminate the risk of transmission of many viruses and pathogens. And prompt medical treatment will help us reduce the complications and the side effects of such diseases. So should there be any symptoms of infection or any communicable diseases, we would recommend immediate medical attention, and doctors will then be able to help to decide whether the bacterial infection, it's bacterial infection or virus or any issues with proper treatment. So we talk a lot about these communicable diseases. So now we talk about the main important discussion that we have today, that will be on non-communicable diseases. So like we have mentioned earlier, communicable diseases are diseases that can be spread around. Non-communicable diseases, on the other hand, are frankly chronic conditions that are not transmitted from person to person. So they are often the result of combination of genetic, physiological, environmental, and behavioral factors. But frankly speaking, a lot of these behaviors are actually being understood in the sense that you will follow the people who eat a lot, you will then develop a habit of eating a lot. So it's important for us to surround ourselves with healthy individuals who have a healthy lifestyle and habit, as not to be influenced to cause us to have any non-communicable diseases. Genetic something like our DNA. Each individual will have a very specialized condition, in the sense that everyone has a different genetic markup. Because our DNA doesn't really change often, if we are with a genetic predisposition for diabetes, for hypertension, for coronary heart diseases, we ought to do extra as to not cause our genetic predisposition to come into fruition, in the sense that we have high risk of diabetes. So all the more we should not just reduce our sugar intake like a normal person who can take every now and then. All the more we should not take it as much compared to the normal people. It could be also physiological. Our body is just made up differently in different environment. So it also can cause us to develop different kind of result as to cause us to have chronic conditions. Environmental as well. It could be when we are in a high stress environment, work environment, all these can cause us to have high blood pressure. So all this could be one of the reasons why we have high blood pressure. So behavioral factors is also an important part, which is our diet. If we have a behavior of a sense that every time we are sad, we eat a lot, it will cause us to have a problem with cholesterol, we'll have problem with diabetes, eventually will lead us to obesity. And non-communicable diseases generally, compared to communicable diseases, have a slower onset. It typically develops over a long period of time, and it could take years or even decades. But as our competitive nature develops, our youngsters nowadays are doing their best to run to make it a quick thing to happen, because we have seen over the years as medical doctors, a lot of younger people, they are speed running the process of non-communicable diseases because of behavioral factors such as their diet. With lots and lots of food high in sodium, fats, they really accelerated a lot of these kind of diseases that typically in the past we'll see in the age group of 40s to 60s. We are seeing an uprise in non-communicable diseases amongst the younger population. At about late 20s to 30s, we're seeing a lot of new diabetic patient, high cholesterol patient. But however, it should be noted that non-communicable diseases can be prevented or managed through lifestyle modification, such as I mentioned before, a balanced diet, regular exercise, and avoiding harmful habits. Okay, which we will discuss in very detailed manner in a short while. Is there any question regarding communicable diseases and non-communicable diseases? All is okay, huh? So I think it's rather detailed in explanation between these two. So these are the examples of non-communicable diseases amongst our general population here in Malaysia. It is diabetes, diabetes mellitus, mainly type 2 diabetes, hypertension, dyslipidemia, which is high cholesterol, kidney diseases, chronic heart diseases, as well as cancer. And yes, cancer is a non-communicable disease as well. Why? Because it goes through all the criteria of being slow onset, depending on the cancer type, is spreadable in the sense that it's non-infectious, and it actually could be prevented or reduce risk due to lifestyle modification and some preventive methods. So we will go into further detail regarding 3 of the most common issue here in Malaysia. But before that, I would like to ask the floor, what do you think, who and which country has the lowest obesity rate in ASEAN? Which country do you think has the lowest obesity rate? Is there anyone interested in answering? I'll give you a clap later. I see that Lily, you're interested in answering. Give it a guess.
Maybe Japan.
Japan. What about Zue? You want to give it a try? You can think about their national dish. What are the food they normally eat in these countries? ASEAN countries include Japan, Korean, Malaysia, Indonesia, Vietnam, all these. What do you think is the national dish for each country, and which one do you think looks the healthiest?
Vietnam.
Vietnam? All right. So we can look into the answer here is correct. Vietnam has the lowest risk of obesity because a lot of times obesity and non-communicable diseases are actually the cause of premature death in Malaysia. 70% of all premature death is actually due to non-communicable diseases such as heart disease, cancer, all these things that can, in a certain way, be prevented. So it is important for us to look at the obesity rate because a lot of times obesity is not a single metabolic issue only. It is a culmination of cholesterol issue, diabetes issue, and kidney problem that over time will cause us to have obesity one way or another. And the ASEAN country with the lowest obesity rate actually is Vietnam because of their lifestyle and their health habit in the sense that their food. When you go to Vietnamese food restaurant, you will see their food like pho, all this, right? One bowl of noodles, they will be accompanied by a whole set of vegetables. So they are the population where they take a lot of green vegetables, which is very helpful for our health. Whereas in Malaysia, with the highest obesity rate in Southeast Asia, our national dish are all dishes that has the word oil in it, which is lemak, everything at oil. It could be in the form of coconut oil. It could be a lot of different oil, but most of our national dishes are very, very high in either sodium, fats, and all these tasty little ingredients. So I would say it is very important part of our nation building is to change our diet habits. So we will go into further detail regarding the issues surrounding our Southeast Asia, especially in Malaysia. So I would like to ask the public, what do you think? In every 5 people, how many people of the 5 people, right, will have diabetes? Out of 5, how many do you think will have diabetes?
3 maybe.
3. What about Lily?
Maybe 4.
Okay, wow, you're very, very hardcore. That means 80% to 60 to 80% of population will be with diabetes. A bit too hardcore. I would say 1 in 5 adults will have diabetes, and majority of them will not know that they actually do have diabetes. Why? Because of the lack of health screening. According to the National Health and Morbidity Survey 2019, it is estimated that for every 5 adults, there is 1 adult will have diabetes mellitus, which is a HbA1c valuation of more than 7. Okay? This is the guidelines set by National Health and Morbidity Survey. But medically, a lot of times when patient has HbA1c of 6.3 and above, it is considered diabetic patient. So there is approximately 3.9 million adults aged 18 and above in Malaysia that is diabetic. So this is a large population in our country. So I would say that diabetes is actually sort of a gateway disease into a lot of other very insidious diseases, such non-communicable diseases for us. So a healthy individual with HbA1c of less than 5.7 is considered non-diabetic. If HbA1c valuation of 5.7 to 6.2, that is considered pre-diabetic. All right, so do take note. HbA1c of less than 5.7 is considered normal, whereas HbA1c 5.7 to 6.2 is considered pre-diabetic, and 6.3 and above is considered HbA1c of diabetic patient. All right, so that is for diabetes. Okay, so diabetes, what are the complications that you can develop from this issue? We will show you in further detail in a video shortly after this. So we now talk about dyslipidemia, another popular chronic non-communicable diseases here in Malaysia. With cholesterol issue, this is worse. Out of every 10 adults, there will be 4 of us that will be with high cholesterol. And almost a quarter of them will not be aware of a diagnosis. And 3 over 4 of them don't want to know, but actually knows that the body is really developing issues because of our food that is available in our market right now. You will be hearing a lot of new openings of fast food companies that will be opening here in Malaysia, and a lot of time, they are actually very unhealthy. So as we can, let us make sure that we have a proper control of our diet. For dyslipidemia, we have cholesterol that is, cholesterol in itself is not the enemy, but we have good cholesterol and bad cholesterol. Good cholesterol is HDL, which is high density lipoprotein, which is HDL is actually the good protein. It is functional in our body and it's very essential. But on the other hand, a lot of food that is available in the market that is hyper processed, ultra processed, is actually increasing our low density lipoprotein, which is LDL. So that is the main issue that is causing our plaque formation in our arteries. Because of this issue, it will develop into our next big deal, which is hypertension. With issue with our blood vessels, hardening of our blood vessels because of plaque formation, narrowing of the vessel, it will act as a pipe that is not flexible. When it's not flexible, the flow inside our vessel will increase its pressure, causing us to have hypertension. So a lot of times people with dyslipidemia, which is the problem with cholesterol, will develop eventually hypertension, which is 3 out of 10 adults in Malaysia have high blood pressure. The key word we need to know is that blood pressure should not be more than 140 mmHg for systolic and not more than 90 mmHg for diastolic. So should any one of you be around here should really get a proper good quality and MDA approved blood pressure machine so that you can monitor your blood pressure at home to ensure that your blood pressure should at any time not be higher than 140 and 90 with the exception of during exercise lah. Okay, so hypertension, this dyslipidemia will cause hypertension, and hypertension in the long run may cause heart problem. Because of the high pressure you exert onto your heart, it will have heart failure issue in the future. So these 3 main diseases here in Malaysia that is plaguing our society is diabetes mellitus, our dyslipidemia, and hypertension. So these 3 will be our main focus today. Because of the 80-20 rule, we want to focus our attention onto the 20% that gives us the 80% of the result that we see often in our population here, which is the 3 highs, the diabetes, dyslipidemia, and hypertension. So may I know what are the risk factors that you know of that could cause us to have this risk factor, this non-communicable diseases?
Diet,
Diet. Diet, yes. What about Lily?
Unhealthy food.
Unhealthy food, so that's also diet. What about other behaviors? Do you think that will cause us to increase our risk of developing issues?
sleeping quality,
Sleeping quality, yes. Sleep deprivation will also could be a factor in. One more from the floor. What do you think? What do you think? All right, so never mind. We will have a few more risk factor, which is first and foremost actually is our smoking habit. Smoking can cause us to have higher risk of high blood pressure, problem with our cholesterol. So this can also be a risk factor. And then we talk about lack of exercises, especially with the sedentary lifestyle that we have currently in the population, where we just look at the phone or watch TV for long periods of time, being a couch potato. It really causes us to have higher risk for all the other non-communicable diseases. Why so? Because with exercise, we are able to expand energy, in turn will burn our fats and increase our metabolism. That way, it can help us with our condition where our sugar level will not consistently be very high. Our blood vessel will be very practiced, because when we exercise, our blood pressure will go up, and then it will increase the elasticity of our vessel, making sure that in the event our blood pressure increases, it has the elasticity that may not cause it to burst, causing stroke in its way. So exercise is very important in improving our metabolism, improving our mental health, because when we exercise, you will notice that you will feel happier over the long run. So that is very important. And another risk factor is unhealthy diet, where we only focus on food that tastes very good, where it's added sodium, added fats, added lard. All this could actually worsen our risk, in making it riskier for us to have dyslipidemia, hypertension, because of high sodium intake. So diet is actually a major criteria, a risk factor that can cause us to have non-communicable diseases, such as overweight. Overweight or obesity is also a risk factor. So patients who are obese, they run the risk of getting diabetes, getting dyslipidemia, and getting hypertension because of the high fat content in the body. It can cause that. Another factor that is affecting us is factors such as family history. Like I mentioned earlier, diabetes, hypertension, dyslipidemia, all these can be inherited in the form of our DNA. That is passed down through generations, where certain people with certain gene will have a higher predisposition in getting such diseases. And not just family history. Family history is not all about just DNA. It is also a lifestyle inheritance, in the manner to say that if father and mother do not have the habit of exercising or preparing healthy food, very often the child will follow suit. They will not exercise as much because no one brings them or encourage them. Another part is the food preparation at home, where it's very savory, very sweet, all these, they will develop a different palate, and over time, it is actually at a higher risk of getting certain non-communicable diseases. So these are the risk factors. These are the information that is not exhaustive. There are many other risk factors as well that may contribute to all these diseases. It could be in the form of mental stress. It could be in the form of social group issues that develop us to have different kind of stress that can cause us to binge eat, to do a lot of unhealthy lifestyle activities. So these are the few risk factors that we are discussing right now. So when we talk about risk factor and all that, diet plays an important part. Malnourishment is the wrong nourishment method, is the means to say that we are not well nourished. It could be considered malnourishment if we are overnutrition. So as to say, if we eat something that is not good, there's still some nutrition, but we overeat it, it may cause us to have other issues that is associated with it. So overnutrition, recognized by WHO as a form of malnourishment, refers to health issues from excessive nutrient consumption, including obesity and microdosing overdoses. Whereas a lot of times we will see more is undernutrition. So certain nutrition, certain minerals that we are actually lacking of because of inadequate diet or poor nutrient absorption. Because a lot of times we are eating out, we don't have a control of the food that we take, which will cause us to be thinking that we are eating a lot of healthy food, but the important nourishment, we didn't take it. Take vitamin D, for example. Majority of the population will benefit from extra vitamin D injection because of our inability to obtain it all from just the sunlight, our food, our whole foods. So we have done the studies with the school teachers and all that. We actually managed to see that actually close to 30% of our population is actually under malnourished for vitamin D, with deficiency or insufficiency being a keynote for that. So nourishment is an important part of our healthy lifestyle. So I will share with you regarding this, which is what is diabetes mellitus. So I will share with you a short video to explain in detail with graphics about what is diabetes mellitus.
System into nutrient molecules
And
that are then
see it. Okay.
Yes.
Okay. All right. So we shall see the video.
is a metabolic disorder that causes sugar in the form of glucose to accumulate in the blood rather than being used as fuel by the cells in our body. When we eat, food is broken down by our digestive system into nutrient molecules that are then absorbed through our digestive tract for use by the body. Foods containing carbohydrates or various sugars are broken down into glucose. Glucose is an important source of fuel for many organs in our body. However, to be able to use the glucose for fuel, the glucose molecule must first enter into the cell. The pancreas produces a hormone called insulin, a chemical messenger essential for the entry of glucose into cells. As the blood glucose levels rise after a meal, insulin is released into the bloodstream and sets processes in motion to trigger the removal of glucose from the blood to enter into the cells. In type 2 diabetes, the cells become resistant to insulin and ignore its message to absorb glucose. This is known as insulin resistance. In addition, in type 2 diabetes, the pancreas is unable to produce the greater amounts of insulin needed to trigger these resistant cells to take in glucose from the bloodstream. The most notable symptom of diabetes is frequent urination and excessive thirst. Other symptoms include weakness, drowsiness, and blurred vision. These are caused by chemical imbalances in the blood related to high levels of blood glucose. About 1 in 4 people with type 2 diabetes are unaware that they have the disease. It is important to catch diabetes early. Over time, high blood glucose damages the blood vessels, which can damage the organs that these vessels supply, leading to a variety of health complications. Damage to the small or micro blood vessels can cause vision problems, including loss of sight, nerve damage, and kidney disease. Damage to larger or macro blood vessels can lead to cardiovascular complications such as heart disease, stroke, and poor blood circulation. Overweight and inactivity are major causes of diabetes. A family history of diabetes significantly increases your risk of developing the disease. Certain ethnic populations are also at increased risk of developing type 2 diabetes. Finally,
All right, team, we're transitioning to FLAC, but tasks are still going to be on Bullfrog. Did nobody see my puppy cup?
finally, some medications may increase your diabetes risk, specifically corticosteroids, thiazide diuretics, drugs used to treat certain mental illnesses, and some antiretrovirals used to treat HIV infection. In summary, type 2 diabetes is a metabolic disorder. It causes sugar in the form of glucose to accumulate in the blood rather than being used as fuel for the cells in our body. If not diagnosed and treated in a timely manner, type 2 diabetes can lead to many health complications.
Okay, so with that short video, I would wish that everybody is able to understand diabetes mellitus in a better manner, with graphics and all that. So through that, we are able to know that diabetes mellitus is actually the problem with excessive glucose in the bloodstream that is not absorbed into our body. Because for absorption of glucose into our body, we need insulin. And overproduction of insulin will cause it to reduce its release and also make it not as effective. We can think about it like a factory where we overwork the workers will cause us to have lower production level. Hence, our product will be reduced, output will be reduced. So if we work our insulin too hard, they will go on strike. So by having strike, our insulin loses its function. So that will cause sugar to contain in our blood vessel in a high volume. So what does it do to our body? As the video mentioned, a higher amount of glucose in our blood vessel can cause damage because it's inflammatory. It causes inflammation of our blood vessels. So if it's at the small blood vessel, it causes it to not function well. And then that's why you see people with diabetes will have problem with pins and needles and loses their sensation in their peripheral parts. So their fingers will not be as sensitive as the one that we have for people without diabetes. That's why the family friend of mine who had diabetes will eventually have diabetic foot ulcer because he has no sensation on his toe when he's walking around. He's a bit more careless and there's injury to his toe, but he don't feel it. For us to feel pain is very important because when we feel pain, we will take care of that injury site and do preventive method, clean it up, take care of it. Because of diabetes issue, his toe is injured, but he don't know. So he never take care of it, so it get infected. But because of poor circulation at his periphery, which is this small micro vessels, no blood flow, poor circulation there, the wound does not get healed because there's no white blood cell can reach there to heal the location. So it start to develop ulcer, which is infection. So over time, it spread out. He has to cut it. So to prevent bacterial infection going into the blood to cause him to die off because of sepsis. So cutting it off, then the stump there is also poor circulation. And then the stump also don't heal well. Then eventually they will cut from the foot to the shin to the knee, then all the way up. So that's why you hear in the colloquial method of saying something is very sweet, we say manis potong kaki, because it's so sweet that you will have developed diabetes that will end up having to cut your leg out, to amputate your leg. So when we discuss with patients who have diabetes, we always ask them to do this at night, is to look at your hands and feet for any wounds. And if should there be any wound, you need to go to the doctor to do very thorough and regular cleaning to prevent diabetic ulcer and risk of amputation. Then we talk about another complication of diabetes, which is eyesight. Why is that so important and so prevalent? Because again, poor circulation because of damage to the microvesicle will cause all the blood vessels behind our eyes, which is providing blood flow, to spoil, to not work properly, eventually causing us to have diabetic retinopathy, which is diseases of the retina because of poor circulation. So poor circulation, then poor nourishment to the area, and then no oxygen go, then the operations dwindle. So your eyesight reduce and you will go blind because of the rich microvesicle behind your eyes that is providing all the blood flow. So diabetes sounds like something not very important, but actually it is very, very important and very high risk. So let us not take it for granted and take care of ourselves with diabetes mellitus. I will share regarding what can we do later on. Now we talk about the next one, which is what is hypertension. So we talk about diabetes. Let us learn a little bit more regarding hypertension, which will show another short clip.
When your heart beats, it pumps blood around your body. As the blood moves, it pushes against the sides of the blood vessels. The strength of this pushing is your blood pressure. As your heart pumps, the flow of blood in your arteries and your blood pressure rises and falls in a regular wave pattern. Blood pressure is shown as two numbers. The top number, or systolic pressure, is the pressure when your heart beats. The bottom number, or diastolic pressure, is the pressure when your heart relaxes. Healthy blood vessels can stretch to allow for these changes in pressure. Damaged blood vessels are less stretchy, which increases blood pressure. Constant high blood pressure puts extra strain on your heart and blood vessels. Over time, this increases your risk of a heart attack or stroke. It can also cause problems for your eyes and kidneys. High blood pressure speeds up the process of atherosclerosis, where fatty streaks form inside the arteries. If one of these cracks, it can cause a blood clot in your arteries. This is what causes a heart attack or stroke. It's never too late to make changes to protect your heart. Think about your future, being there for your family, your plans and dreams. Could your blood pressure affect this? There are small steps you can take today to lower your risk. If you smoke, stop smoking. Make heart-healthy eating and drinking choices. Move more, lose weight. Talk to your doctor about medications.
All right. I hope with this short video, you're able to visualize what is the problem with high blood pressure. The video have shown that when our heart is healthy, it is our blood vessel is stretchy. So when the pressure increases or the demand heart increase, our blood vessel were able to stretch. Okay, A little bit more stretchy will be due to our exercise. When we exercise and we strain our heart a little bit, and then it gets stronger like a muscle. It gets better. But if we don't do exercise and we eat a lot of fatty food or food that is high in sodium, that can increase our blood pressure, and that blood vessel that has plaque, like the fatty deposit we saw earlier, can make our blood vessel harden. So when that happens, our issue with breakage of the plaque will increase the risk of heart attack. And if the vessel is so hard that causes it to break off when there's very high pressure, causes the blood vessel to rupture, it can cause something we call as stroke. So what happens when you have stroke is your blood vessel break. Okay, so if you have blood vessel break in your brain, is a stroke, then it causes your blood to not go to the area of the brain that is necessary. That's why you faint, you have all these symptoms, you have your droopy feeling, you have pain, everything. So it's all because of your blood vessel. So blood vessel is very important in our life. It's the highway in our body that giving all the nutrient to all parts of our body. So if there's issue with our hardening of the vessel near our kidney, it can eventually cause us to have kidney problem. Yeah, so all this is not just something that we can scoff at, because hypertension is a silent killer. You don't normally feel the symptoms of it until it's too late. So regular screening and regular monitoring is essential to know whether what is our standing in regards to hypertension. So there are a lot of risk factors for this, particularly in food that is high in sodium. Sodium can cause our pressure to increase because of the osmolarity of things. So it can cause us to have high blood pressure. So one of the ways to reduce the risk of hypertension is to reduce sodium intake, which is all the processed food that we have today. So that's one key component, and also our smoking. No smoking, it will help us very much. All right. So we talk about risk factor again, and what we can do, and what are the things that can help us improve our condition. Because I have been sharing with everybody regarding the scary part of the things. So now I will give power back to you in controlling it, in the sense that we will be sharing things that we can do to prevent all these diseases, particularly in our diet and nutrient intake. So we have been saying this a lot, is that risk factors is family history. So a strong family history of hypertension means that genetically you are predisposed to have hypertension because of a certain gene in your body. But by having this DNA with higher risk of hypertension doesn't mean that you will definitely get it. I will set an example for, let's say, a couple, a twin share the same exact DNA. At 40 years old, one twin has a healthy lifestyle, exercises a lot, run marathons, healthy relationship with family members, with partners, with friends, social group is very good. Workplace stress environment is adequate, just enough stress to challenge her, but not enough stress to worry her. This one is living the perfect life with the perfect surrounding. The other twin will then actually have a terrible relationship with the family member, with the husband, bad sedentary lifestyle, workplace stress toxicity is very high, doesn't really eat healthy, always binge eat and binge watch TV, and then doesn't control her diet, eat all the ultra processed food. At 40 years old, one will have gotten a heart attack or hypertension, but the other twin can run marathon, can do all the exciting things in life. Why? When both of them have the same DNA. Because all the factors I mentioned earlier, they are called epigenetic factors, the surrounding factors, the social life, the stress level, the diet, the exercise, everything actually plays a part in activating or deactivating the genes that we have for certain diseases. So when you have genes that can cause you to have hypertension, you merely has that switch in your body. So if you are able to eat healthily, live a healthy lifestyle, good mental health, everything, you are switching off that switch. You have it, but you don't activate it. But if you don't eat well, don't do everything right, you are activating all the bad genes that you have, be it hypertension, be it cholesterol, everything. So it is important for us to understand our body through DNA tests to further know all the switches that we have in our body. So risk factors such as family history, aging, in a sense that as your body ages, if you do not do any regenerative methods, efforts or prevention efforts, your body is just gonna age. It's gonna just get worse and worse if you don't maintain it well. So your vessels will lose its stretchiness and all that due to age. You're not supplementing it well. High salt diet, smoking, excessive alcohol, stress, especially in our current environment where stress is such a big part of our life, be it from workplace, be it from economic sense, be it from a lot of ways of stressing us out. That can also cause us to have hypertension. Especially people with obesity will have higher risk of hypertension. So when we have this problem, what are the nutrients that can actually help us? It has been studied that coenzyme Q10 is able to improve our blood vessel, our heart health, as well as giving us a boost of energy along its way. Potassium and magnesium are all essential minerals that can help us manage our hypertension, manage the blood vessels, and also relaxes the muscle in our body, hence improve our blood pressure. EPA, DHA, they are omega-3 fatty acids that is able to improve our inflammation in our body, to reduce the plaque formation in our blood vessels, to reduce the inflammation in our blood vessel, which is actually causing hypertension. Garlic is actually very good component where inside they have this allicin that is very helpful in helping us reduce our blood vessels inflammation, because it's a very potent inflammatory nutrient. So these nutrients can be taken from whole fruits and food such as brown rice, which is actually better than white rice, which is not as ultra processed as our typical white rice. We have seeds like chia seeds, flax seed, pumpkin seeds. These are all high in omega-3 fatty acids, as well as potassium and magnesium. Fatty fish such as salmon, even our mackerel, the one that we see very often in our market, is actually very helpful for us in the form of omega-3, as well as all the magnesium, potassiums that you need. So not just fatty fish such as mackerel and salmon, we can also get it from pomfret. Then we talk about citrus fruits, such as your grapefruits, your oranges. All these are very helpful. Bananas, apples, berries, pomegranate, beetroot. Beetroot is another superfood that's very helpful in reducing our inflammation. Garlic, cinnamon, pistachios, and leafy green vegetables, which you will see leafy green vegetables in most of our beneficial food because it is so packed in minerals and nutrients that you need. And surprisingly, dark chocolate is very anti-inflammatory, but you have to get the dark cocoa one, which is about 70% and above of chocolate. Then it's very helpful. If you have those dairy chocolate, then it's not that great. It's very inflammatory. So then we talk about dyslipidemia. So the risk factors are similar with family history, aging, high-fat diet, smoking, excessive alcohol, diabetes, and obesity. These are all the risk factors for us if we are developing dyslipidemia. So let us take a good look at our typical diet daily. Is it high in fat, especially with all the yummy food that we have in Malaysia? This is a national epidemic because a lot of times we will subconsciously choose the fattier food when we are hungry because it is in our brain, it is our gene to look for high-fat food. Because why? In our primitive mindset is that we don't know when our next meal is going to come. So in the past, we always aim for high-fat food. But now, food is abundant. So it's actually harder for us to really take care of how we eat our food. So if you can, when you're outside, look for low-fat option. Okay, so the nutrients that can help us to absorb our fat better is first and foremost soluble fiber. Fiber that is able to help us take cholesterol and bring it out of our body together so that we can not absorb so much cholesterol into our body. So fiber is very important. All right, so niacin, our B3, is very important as well. So red yeast rice extract has been shown to really help us reduce our cholesterol level in our body, especially in used for patients with high LDL. Many studies have shown that it really helps us to reduce our cholesterol level. EPA, DHA similarly reduces our inflammation that can help us with reducing our plaque formation and reducing the LDL in our body and increasing the good cholesterol, which is HDL. So that is very important to us. So that should be something that we look into, especially plant sterols and stanols. These are all considered very helpful in reducing our cholesterol. This can be found in brinjal, okra, guava. All these can able to bring us a lot of plant sterols as well. So ikan kembung, lentils, chickpea, fatty acids such as mackerel and salmon, almonds and walnuts have high concentration of EPA and DHA. Brown rice, tofu, and tempeh has a lot of soluble fiber that can help us to reduce our cholesterol level. So we talk about dyslipidemia right now. So diabetes mellitus, risk factors are family history with as well as aging, high sugar diet, and physical inactivity as well as obesity. These are all the risk factors for diabetes mellitus. So high sugar diet is also very prevalent in our Malaysian cuisine, especially with all the kuehs and all the food that is very sweet. So it is important for us to look for the kurang manis. All right. So later I'll share with you a few tips and tricks on how to improve our condition with just a few modifications. So nutrients that has been studied that can help us tremendously, that is being used in my practice a lot, is alpha lipoic acid, chromium. These are all very potent diabetes reducing nutrient that can be used in lieu of medication to help us to reduce our diabetes level, which is our HbA1c. Magnesium, EPA, DHA, and cinnamon are very helpful things that can help us to reduce it as well. So beneficial food, you will see a trend here is that most of the time it is brown rice, lean meat, fatty fish, good fatty fish, tofu, tempeh. Guava is a superfood because of its high concentration of vitamin C that is antioxidative, that can reduce our inflammation caused by our diabetes. Berries, chia seed, flaxseed, garlic, cinnamon, pistachios, as well as our mainstay, leafy green vegetables and dark chocolates. So you can see a trend here. So I would like to ask a question to the public, to both of you, is that how many sugar cube do you think there is in each 330 ml of Coca-Cola? Do you want to take a gander? Lily, how many?
30 cube.
Wow. Okay, 30 cubes. Zue?
20 maybe.
Oh, you're hardcore one. But actually, it is 9 cubes. If you stack it up, it's quite significant. So one small can of soda actually have 9 cubes of sugar. That's 39 grams. And our daily max recommended amount is 6 cubes. You don't just take sugar from your soda only. You take it from your food. Take it from a lot of naturally occurring sugar in our food. So it is important for us to really understand what we are drinking. I'm just saying soda now. Coca-Cola. I don't know how much sugar is there in our Mi Xue, in our Tea Life, in our Starbucks, in our, what now is famous one? In our Zeus coffee, how much sugar that you choose? What kind of syrups they use? How concentrate is it? Especially the high fructose syrup that's being used widely. So all these are very inflammatory food and really has a detrimental effect on our body. So what can we do? So like I mentioned earlier, we can do first and foremost healthy diet. So diet, like I shared earlier, are all the food that I mentioned. I will go in detail in a short while. And then another thing we can do is exercises. Exercises will also be explained on what kind of exercises and how long we should do and what are the benchmark we should have for each week. And then we need to do screening. Why? Because if we don't do screening, how do we know if we have any issues? in the past, it is recommended for everyone aged 40 and above to do regular yearly screening. But because of the changes in our lifestyle habit in the society as a whole, with the prevalence of all the very enticing food that we have in the market right now, I would recommend to do yearly screening for most individual aged 25 and above, because this is anecdotal experiences that I have, is that a lot of times, a lot of these chronic diseases develops after that age because of our bodies reducing metabolism. We start to be more developed in our career, hence reduce a bit of more of those activities that we have, leisure activities and all. Increased stress causes us to develop non-communicable diseases at an earlier age, unlike our age group in our seniors in the past. So I would always urges the public to do yearly screening if permissible, yearly, and then to maintain the healthy weight. So it's important to note that BMI is not an end-all be-all. BMI is a guideline because we know muscle is heavier than fats. So some people who are gym goers, who pack a lot of muscles, will have a higher than usual BMI. But for the majority of the population, most of us are not bodybuilders. So maintaining a BMI of less than 25 should be a benchmark for us. But there are definitely special cases. So I don't want to focus too much on the BMI, but more of your ability to be mobile, to feel light. Okay, so keep a healthy weight so that we don't just feel very lethargic all the time. Okay, so food recommendation. This is where we go into more detail. So our fatty fish, like I said earlier, it could be not just salmon fish, which is very much recommended by most Western media. But frankly speaking, we don't have that access all the time here in Malaysia. So other fatty fish could be ikan kembung, ikan tenggiri, which is Spanish mackerel, and sardine. These are all good local fish that is rich in omega-3 fatty acids. You don't just get omega-3 fatty acids from this fish. You get high quality protein, a good amount of minerals and nutrients that is high in this group of protein. Your good amino acids and all that will be prevalent here. So I will always say that fish meat protein is very nice, very good. Okay, but then we should also limit the intake of large predatory fish such as tuna and all that. Why? Because of higher mercury content. Because small fish have small mercury, but big fish eat all the small fishes, so their mercury content is slightly higher. Particularly for pregnant ladies, we always recommend to reduce the intake of this kind of big fish such as tuna and all that during their pregnancy because of the risk of high mercury exposure. Then we talk about nuts and seeds. Our buah keras, our candle nut, our sesame seeds can be used to be added to our local dishes, to whatever that we cook, right? We just spread a little bit there. We can take it with our yogurt in the morning and all that. Just add a little bit of nuts and seeds, crushed nuts. It really adds a lot of texture in our daily food when we stir fry our vegetables, because they increase the amount of protein that we take the fibers that we can get from all these seeds, especially chia seeds. Chia seeds are all very good for our digestive system because these are considered as prebiotic food. Chia seed, especially if you soak it a little bit, you will notice that it will bloat up. These are all very high amount of fiber that can really help you detox, increase your stomach motility, increase your frequency, and improve your gut health. Because of all this soluble fiber content, it helps to facilitate our gut microbiome to develop, to be well nourished. Because how do we reduce bad bacteria in our body? By increasing our good bacteria. So candle nut, sesame seed, chia seed, flax seed, these are all very good source of prebiotic food, soluble fiber, our proteins as well, and a lot of amino acids. And then the mainstay, our leafy greens, our spinach, our water spinach, our mustard greens are all very, very fresh and widely available here in Malaysia. Did you know that leafy green vegetables actually provide an adequate amount of iron? As special as it sounds, you can actually get a lot of irons from our leafy green vegetables. All right, so these are very good source of iron in our diet. So especially for our friends who are vegetarian, they can really benefit from taking leafy green vegetables like this. Then we move on to whole grains. We recommend brown rice and red rice as an alternative to white rice because they are a higher amount of fiber in it. Better for us because why? We want to reduce ultra processed food in our diet. Because a lot of times when we take white rice, it can cause us to have a glycemic index higher and causes us to have a sugar spike. So do you have any point in time after you go to a kanduri or after you go to a feast, where eat a lot of rice, a lot of biryani or whatever, you will have food coma right after? Because it causes our body's sugar level to spike up. The glucose from white rice is immediately processed because it's already been processed in the factory. It's in its ultra processed form. When we eat it in excessive amount, it causes us to have the spike in our sugar level. And then when there's a high spike, immediate spike, you will have a very quick crash. So when the sugar level crash, it can cause us to go into food coma. Not to sound so scary, but you just make us feel tired, suddenly feel like sleeping, which is why at 3 p.m., a lot of times after lunch hour, people have this 3 p.m. crash where they just suddenly feel like taking a nap because of a high sugar index and then quickly calm down. So we always recommend taking alternatives such as brown rice or red rice to help us to slowly increase our sugar level gradually and not immediate spike up. So we can study more about glycemic index in the future. And then legumes, such as kacang merah, which is our red beans, our long beans. Lentils are very good source of protein for our vegetarian friends. Even for all of us who take every type of food, we should include a lot of legumes in our diet because these are all high in our vitamins, our minerals and proteins that is very helpful and it's very dense with nutrient. So we should add it into our diet, our whole food diets. And as I mentioned above, probiotic food and prebiotic food are food that is very helpful for us to take care of our good gut microbiome. We are looking into a lot of new studies to show that gut microbiome plays a very essential part in our health, be it our digestive system, which will improve our condition in reducing inflammation. It improves our absorption of nutrient. It improves our gut health, reduces bloating, which a lot of our friends in late 20s and 30s will start to have digestive problem. A lot of times they have issues with burping and all this. So with proper gut microbiome, it can help us to reduce those risks and improve our condition whereby we have leaky guts, where we are unable to absorb nutrient well. We have a lot of bacterial infection here. So that will be it. And also probiotic, good microbiome actually improves our mental health, because a lot of our serotonin is actually being produced in our gut, which will improve our mental well-being. Our anxiety will be improved. So a lot of people who have depression actually have a lot of problems with their gut health. So probiotic rich foods are very essential in providing this support. So you see, we always recommend taking yogurt. I will always recommend Greek yogurt as opposed to normal yogurt because of the lower sugar level. And Greek yogurt just tastes better, I feel. And it goes well with a lot of different fruits, such as the one that we have next door, which is berries, with all the different kind of blueberries, raspberry, whatever berries, whatever fruits you just put into Greek yogurt, right? It just tastes better. So I'll recommend adding Greek yogurt into our diet. You can also take kefir. You can take a lot of different kind of this kind of probiotic rich foods that is available in the market right now. Even kimchi is very good. Then we have the German counterpart, which is sauerkraut. It's also very high in probiotic element, which is fermented food basically. And my favorite, which is tempeh, is actually very economical and very good. It's a superfood. The Westerners are actually looking into a lot of tempeh right now. And we have recently started having tempeh chips for snacking. So these are healthier alternatives to our snacking habit. So if we really need to snack, we look into healthier option. You can go into tempeh chips. You can eat banana chips. You can eat all this, but read the label to look into sodium level, preservatives, and all that. They are organic ones. They are ultra processed one as well. So always learn to look at labels. And then we talk about berries. Mangosteen is very sought after and expensive in the Western countries, but here in Malaysia it's affordable. But sometimes problem with us is that we don't appreciate the amount of good stuff that we have here actually. But sometimes I think also they make it more expensive already nowadays. Mangosteen is notorious for staining clothes, so be careful when you eat it. But it's very, very rich in antioxidant. A lot of the Western people are actually looking into mangosteen as they consider it superfood because of its large amount of antioxidant packed into such delicious little packaging. So it's one of the better fruits out there. Your chestnut, you have a lot of local food that is very good. But the key note in eating fruits is that always take it in the form of whole fruit. Don't take it in the form, go and take 4 oranges, do into a fruit juice or press it, just take the juice and drink it. If you are doing that, you're only taking the sugar, taking the fructose. that can cause you to increase your triglyceride, increase your liver inflammation, increase all the issues with your body because you are taking pure sugar. The whole reason we have these fruits in its packaging, in its natural packaging, is that every part has its own use. It's fiber, it's in your oranges, you see all those white stuff, right? It's all fibers. People like to take it out and then eat it without the white part. I don't know what's the name, but it's packed in fiber, has a lot of nutrient. And then when it comes to watermelon, you know the white part, when I finish the white part, right, I get laughed at when my peers look at it. They say, oh yeah, not enough watermelon, is it? I have a lot more here. No, the sugary part, which is the red color part, right, or the yellow color part, it's good, but it's a lot of empty sugars. But this white part, this is where we have citrulline. Citrulline is very antioxidative and anti-inflammatory. In our Asian culture in the past, they actually make soup out of the white part. Some certain culture, they actually cut the white part and make soup because it contains citrulline. It's a nutrient that is very helpful for our anti-inflammation and all that. So always if you can, it's tasteless, it's harmless, eat it, eat the whitish part. Okay, so it's very good for you. And in a normal person, you can't one shot eat 5 oranges, right? Big oranges. But you can drink 1 cup of 5 oranges. So naturally, we are not supposed to take so many at one go. That's why we take it one orange at a time, right? The fiber can help us to absorb the sugar better, can help us to remove the issue better. So let us wait for Ziwei to Lily to come into the system. Is there any issue with Lily?
Maybe her phone battery.
Okay, so we will take a 2 minutes break for Lily to come back.
Okay.
Recording in progress.
Okay, just a moment.
Okay, I'm sorry that my phone battery habis.
Okay, no problem. All right, so let us resume. Okay, so we were talking about our berries earlier and fruits and how we should take it all in its original form. We can now talk about, just reminder, don't take too many fruits at one go and always take it in its whole forms so that you will have all the benefits of all the fibers, the vitamins and all that together and not just the sugar. So that is for fruits. And I don't recommend taking too many fruit juices diet or this. Okay, because those will increase your triglycerides, your fructose level and all that. And turmeric is another superfood that is very high in anti-inflammatory effect. This is why you see a lot of Asian cuisine, such as Indian food and even Malay food, has a lot of turmeric in it. Kunyit, ginger, garlic, these are all fantastic, nutritious, and heart support nutrient. it helps to reduce inflammation tremendously. Particularly in patients with arthritis, we always recommend turmeric as an important part of their diet because of its anti-inflammatory effect. So what we can do, what else? So we can do exercises. So exercises, we recommend these 3 types, either one. All right. So moderate exercises, we should at least do 150 minutes weekly. For us, is that making sure that we do at least 30 minutes for 5 days a week of, be it brisk walking, leisure swimming, even gardening is considered exercises. Where we go out, where we do anything that increases our mobility, then we should at least do 30 minutes each day for 5 days at least. So a cumulative of 150 minutes weekly. Then we go into high intensity activity. Could be running, it could be cycling, it could be jumping rope, or even HIIT, HIIT, which is high intensive interval training. So those are short bursts and short. So you can do 75 minutes each week. It could be 25 minutes each session. It could be together 75 minutes. It could be badminton every week, 2-3 times a week, or one shot 75 minutes of badminton, football, basketball, whichever. These are all considered high intensity exercises. So the most important part is to keep your heart pumping. Or alternatively, you can do a combination of both. You can do dance, you can do Zumba, other team sports like I mentioned earlier. It's considered as a combination. So all this you can do at least 1 to 2 hours a week. So that can help us to improve our heart health, improve our metabolism, and improve our immune system. You will see, particularly in people who exercises a lot, who eat healthily, will have a better immune system. So it is important for us to look into exercises. You can even try out the new pickleball, where it's all the rage now, where everybody is doing that a lot. So I always say all this hype is fine as long as we get the heart pumping for the population. So this is important. So then, what are the workplace heart habits we can improve on? Okay, so some people in the corporate world, or people who work in retail or work wherever, we should incorporate some activities in our work as well. You can take 5 minutes micro breaks to actually do some stretching, or simple short stroll around your workplace to get your circulation going instead of just sitting down for 8 hours a day. So exercise, do some stretching, take a 5 minutes break to do all that. Actually, the best habit for us actually is the 20-20 rule, which is every 20 minutes, we should rest our eye from focusing onto a screen or our paperwork to look 20 meters away for 20 seconds. That is also another activities that we can do to improve our eye condition. So not just for your heart, your eye activity also can improve. That's why we don't have so many problems with headache, with our eyesight problem, because sometimes when we focus too long, our head will have some issue, will have migraine and all that, because our face is all tense up, our eyes is all tense up. So it is very important to do all this. So have some break, have a short break, limber up and all that, okay? So these are the things that we can do, all right? So this is important. So then we talk about food, all right? So whenever we have our lunch, we should try to replace it with a healthier choice, such as choosing nasi kerabu instead of nasi lemak, because it uses less coconut coconut milk. Or you can try not just maybe when you eat your chicken, go for the breast meat instead of the hind meat or even the drumstick, because those are higher in content of fats. When we have it in breast meat, right, we will have a leaner cut of meat. Then when it comes to drinks, instead of opting for our daily sugary drinks, we can go for, let's say if you really need the caffeine teh tarik kurang manis, which is better than our teh kau kau, you see? So go for a better alternative. If we cannot omit it completely, instead of our kopi kau kau, we take kopi O. So all this can be small steps, but each day we do better. We just have to improve 1% better than the day before. We are going to have a tremendous outcome. So these are the workplace hard habits that we can incorporate. Okay, so we want to do a case study. So this one will have a participation from the floor, from both of you. Is that let's use our brain a little. Let's practice what we have just learned earlier. Is, let's say we talk about Mr. Frank. Mr. Frank is a 35-year-old marketing executive in a stressful environment. He has a BMI of 28, a BP of 155/95 mmHg, and he has a habit of eating out daily with no exercises. During his off day, he will be binge eating and watching TV all day long. So, what would you recommend a change of lifestyle, design a 3-month intervention for this subject? So, I want the food plan, anything to do to relieve his stress, what is his food option, and then how to reduce his BP, and what should he do during his off day or his after hours. So these 5 points. We should maybe take 2 minutes to write it down briefly, then just share it with the team. What is your solution? You don't have to go to be too grand, just a simple information that we have learned from our session today. So can we do that? All right. So the 2 minutes starts now. Is 2 minutes enough? Need another 3 more minutes?
I'm okay.
Okay.
You ready? Right. Fantastic. So why don't we have Lily to begin first? Lily, the mic.
Okay, on first month, Mr. Frank need to eating less sugar, eating healthy food, start exercise, little bit exercise first, then sleep early. He should change him habit, and then second month will start eating more leaf greens and more exercise, and after second month, so can eat more healthy food lah.
Mm-hmm.
Yes.
Okay. What about his blood pressure? How should he go about it?
Blood pressure,
What kind of food should he reduce?
reduce, eat healthy fatty fish. Healthy fatty fish like ikan kembung, salmon,
Mm-hmm.
and eat whole grain.
Okay. Okay. That's helpful. All right. Will there be any more?
More exercise lah.
Okay. Fantastic. Is there any particular exercise in your mind?
Particular exercise. Like exercise, walking, bicycle.
Okay. All right. That's good. Thank you, Lily, for your effort.
Yes.
All right. Thank you. Miss Lee, would there be any answer from your side?
Okay, I just thought in a general treatment disease, I think Mr. Frank should reduce high sodium food, like processed food, instead of taking processed food, I think he should whole food lah, as in like the original whole food,
Mm-hmm.
or his PP part, and then also having more leafy greens, and also maybe change to brown rice or red rice instead of like white rice kind of.
Mm-hmm.
Yeah. And then he should actually go for all this healthy diet to maintain back his BMI, maybe to lesser or lower BMI, cause a little high. And also he should actually having like more regular exercises. Maybe go for jogging. I mean, those that after work you can go for jogging maybe for about 30 minutes for a start.
Mm-hmm.
Then add on more exercise after 1 month, 2 months, and a regular basis lah.
Okay. Will
Yeah,
there
I
be
think
anything more to add?
that's all for me.
All right, fantastic. All right, both of you show a very good effort in identifying a proper plan, an intervention for Mr. Frank. So frankly speaking, it's fantastic. I really appreciate your effort. And it shows that you have an understanding of our materials today. And it is true from this case study, we noticed that Mr. Frank is a stressed out 35-year-old gentleman with BMI over of 25, with a BP higher than the normal, which is 140 and 90 and above, and doesn't really have a good eating habit, no exercise habit, and it doesn't really do anything to relieve his condition. So all the steps that you have shown and recommended has been fairly well thought out of, particularly in its diet, choosing a better option, maybe changing to brown rice, maybe eat more home cooked, home prepared meal, and then maybe just meal prep lah. Actually, a lot of things that we can do is meal prepping, which is easier said than done, but we will recommend for Mr. Frank to do so if he is unable to find a healthier option in his workplace vicinity. So let that not be an excuse to have poor eating habit. So opt out of white rice, eat more green leafy vegetables, more of fruits, as well as reducing maybe maybe he take coffee with a lot of sugar, frappuccino, whatever, cappuccino, all that. Maybe reduce on that and then start to have daily exercises. Why should we go for exercises? Because it actually can also improve his blood pressure. His diet should also reduce on ultra-processed food, because a lot of times ultra-processed food will include a lot of sodium, a lot of all this that can cause him to have high blood pressure. So all this can also reducing ultra-processed food, also reduce inflammation in his diet. Blood pressure will come down, sodium reduced, blood pressure will come down. And with exercises, it improves his blood vessels, improves his condition. And then it also helped him to reduce stress. When we do exercises, we release happy hormones. So it can also help him de-stress, where he will not be needing to just zone out during his off day. Then he can start doing more socializing with his peers, going out to socialize, to do maybe group activities. It could be group activities such as the now pickleball, basketball, badminton, or even just go for swimming if he don't want to injure himself more. So that can help to reduce his BMI, reduce his blood pressure, improve his health diet, and improve his prognosis, which he will not then go down the hill towards getting what? High cholesterol, high blood pressure, dyslipidemia, all these, or diabetes mellitus. So all this is going to be an intervention. But then why we say 3 months? Because we can't have someone who eat McDonald's every day suddenly don't eat. Because if we don't, he will suddenly have the urge. Then when he say, okay, my 3 months over, I'm going to eat like crazy. So we always must advise a sustainable diet plan. Maybe he eats McDonald's 3 times a week. For the first month, reduce it to 2 times a week. The second month, reduce it to 1 time a week. Then the third month, say, change it to twice a month. Yeah. And then replacing it slowly with good habits. Because if we suddenly need to change 10 things, people is going to have a hard time. So my plan has always been sustainable and gradual changes. So if he has this issue, from these 10 habits we want him to develop, we start slow, 3 habits first. 3 habits after 21 days, it can help you to really fortify this habit. Then we add on 4, 5, 6, 7, 8, 9, 10, slowly in phases. If we boom, hardcore on him, you can have individuals who can change, but that individual will be 1 in maybe 2 in 10. Okay, majority of us is going to fall off. I will fall off. So then we get very disheartened every day. Ayo, I didn't hit my target. Ayo, I'm so horrible. I'm so bad. We become pessimistic. So we must always do positive. So we change 1 thing at a time, 2 things at a time. We manage to do it. We are happy. Then we challenge ourselves to get the 3rd thing done, 4th thing done. Because a lot of time, changing in health is actually a changing of mindset. Everything starts with our mindset. So mental health is such an important thing, which we will go into in our next session. So today we talk about all this. So this case study, we can go into more detail about how we can do it. So This one is a fantastic one. Then another one simple brainstorming thing. Do you think you can come up with a simple policy change in your workplace? Do you think that can help to point us in the right direction? It can be as much as, in our pantry, there will be no sugar. So you drink your teh, kosong. You drink your kopi, kosong. So our policy in our clinic will be no sugar there. Okay, that could be a policy. So along this line, we will have 1 minute, not much time. 1 minute to think about a small thing that maybe can point our company, whichever company that you're at, to help them to point towards the right direction. So our 1 minute starts now. Hey, let us have. Would Zui be able to share with us first, since we had Lily shared earlier?
Can. So I think just a very simple one. I think maybe can like provide some fruits in the daily basis. As in like healthy fruits, maybe oranges, apple, or whichever. For a balanced diet also lah.
Okay.
Yeah.
So stocking up the pantry with
Yeah,
fruits option.
Yeah. Or maybe some simple nuts for also some providing some healthy snack, something like this lah.
That sounds good. Fantastic. All right. So what about Lily?
Maybe can provide exercise to them.
Exercise what?
Exercise room, ping pong table, can play ping pong when free time, and working machine exercise.
Yeah. Fantastic. These are all two very amazing and doable activity and policy to be implemented into many companies. So we can have a recreational room where it's also helpful for mental health. It is also helpful for physical activities. And also it improves the camaraderie in between our co-workers to facilitate a better working environment. With all the toxic environment that we have heard so far. So this one would be a helpful one. So fantastic. Thank you very much for your participation in this brainstorming session, where we actually managed to come up with very doable and very good suggestion for this policy. So thank you. We move on to the next part of our session, which is Q&A. Would there be any questions from the floor regarding the materials that we have gone through today? Is there any question? Maybe a question or two from each of you, if there are any. I'll be more than happy to answer any. Lily has any? Just a simple question.
Maybe I just ask a question about
What, Zui, I can't hear you.
I will ask a question about hypertension part. Okay, so saying about hypertension, right? If let's say we just depend on the food intake, the whole food intake that we are taking, right? Do those like hypertension patient, they still need to take those like medication that prescribed by doctor still?
I
Or
think that's a good question.
it will be only like taking whole food, then it will help.
Okay. Okay, from my point of view, as an integrative doctor, where we practice functional health as well as allopathy, we would recommend, if necessary, to start start medication, we must continue. Okay, continue the medication in conjunction with whichever nutrient that we are supplying. We take nutrient, be it from whole food, be it from any supplements, we take it at the same time. So let's say your blood pressure is this high with this medication, we start low on these supplements of this food diet change. And then over the time, we will do monitoring for maybe daily monitoring, and then we review every 2 weeks. We see at the blood pressure whether it's coming down. So let's say we started this patient because the blood pressure is 155 to 85 with this first medication. It already stopped down to 140, 90. But with our supplements or our food, the BP dropped down to 130, 80. Okay, then we can monitor maybe 1 month or 6 weeks, continue this trend, very stable. We try to reduce the dosing, okay, to half dose, okay. And then we maybe the dosing for the nutrient or the food, we continue or we increase a little bit. Then we see how after 2 weeks, how's the BP? Is the BP trend going up to 150 or 160? If it's so, then we no choice, we have to start back our medication. But if it's not, it's maintaining at 120, 130, then we see after 6 weeks. I don't want to straight away reduce our medication. We over time stabilize 6 weeks. We see, okay, we can reduce. Maybe we reduce to quarter of the dose already. Very low already, chicken doses already. Then we maintain what we have now. BP is still 120, 90, 120, 70, 120, 80. Very nice for six weeks, 8 weeks. Okay. Then we trial offing it. We off it, no? Then we monitor very closely, 2 weeks, 4 weeks, 6 weeks, 8 weeks. BP still less than 140, 90. Then we can off it. Okay. But it all depends on case-by-case basis, where we don't just look at blood pressure. We look at kidney function, we look at liver function, we look at body as a whole. All right? Because we have to be very judicious with our plan, cannot be reckless. Sometimes patient needs to have that medication because it is life-saving. So we have to look into many facets of patient's life on how to manage it, how we can improve its lifestyle, and then slowly taper off the medication. Because everybody will definitely wish that they can be medicine drug-free, right? So we want to achieve that without having the rebound effect. Because sometimes people will be overzealous with giving supplements or you eat this food, but then they straight away off it. But then there might be a critical condition that might just suddenly pop up. So patient safety is most important. All right. Good question. Lily, any question? Zue? Yes.
Thank you very much.
No problem. What about Lily?
Okay. What if for overweight person, do they need a personal trainer for exercise?
Okay. All right. So thank you very much for this question. Does a obese person, will it be helpful for him or her to have a personal trainer? Yes and no. Because if you want to have the best optimal effect, to have the easiest way to go about it, definitely. With a personal trainer, it will help tremendously in planning a regime for you to follow, with someone to encourage you to improve your form and all that. But that should not be an excuse for people who cannot afford it. Because with so many materials online and a lot of research-backed studies on what kind of exercises is beneficial to improve our weight, improve our body physique, we can actually do it with just motivation from ourselves to go for exercises and all that. And most important part of the healthy living is actually achieved through diet. A lot of times it's our calorie intake on what kind of food that we take, how much calorie we take each day. So if you do all the exercises, then each time after that, you go eat chocolate bar, you go eat, you reward yourself with a good cheat meal and all the time, then it's really not going to be helpful for you. So personal trainer is fantastic in accelerating and improving the outcome, improving the speed of outcome, but it is not absolutely necessary for it. So I would say, if you can afford it, you can have it, you have the right support, fantastic. Definitely it's a good thing. But must you have it? Then only you can lose weight? Not necessary. All right, I hope that answers your question. But we work a lot of time with a personal trainer to help us to do better, to help to have a better outcome for our patients. So thank you, Lily, for that question. All right, so we shall move on with the last part, which is quiz time. All right. So what is a normal blood pressure reading? 1, 120/80. 2, 145/85. 3, 155/90 mmHg. Can I have someone who answer it?
1.
1. All right. What about Lily? Is it 1?
1 also.
All right, fantastic. The answer is 120 and 80 is considered normal. So abnormal blood pressure is any reading that is more than 140/90 conventionally. Because we have like a different graph for male and female, but conventionally, 140/90 is considered as the benchmark for any higher is abnormal blood pressure. So it's hypertension. Second, what is the normal value of HbA1? What is the value of HbA1c for pre-diabetic patient? Answer?
2.
2. What about Lily?
1.
All right, that's a different answer. So HbA1c is the average of about 3 months of your blood sugar level. 5.0 to 5.6 is considered normal blood HbA1c, whereas 5.7 to 6.2 is considered pre-diabetic, and more than 6.3 is considered diabetic. So the answer would be 2, which is pre-diabetic, but good effort. So just a reminder, pre-diabetic doesn't mean that you have diabetes, but you have a higher predisposition to have insulin resistance and causing you to have diabetes. So what is not the risk factor of hypertension? Out of these 4, which is your answer?
4.
4. What about Lily?
4 also.
All right, fantastic. So number 4 is sun exposure. Sun exposure would not cause you to have hypertension, but it may increase your risk of melanoma and skin cancer. So always use your sunblock. Family history, obesity, and smoking does increases your risk of hypertension. So summary, today we have discussed and also shared with both of you regarding non-communicable diseases and communicable diseases. What are the differences and what are the mainstay of non-communicable diseases that we see a lot here in our population in Malaysia, which is hypertension, dyslipidemia, and diabetes mellitus. So we have gone through risk factors. We have gone through what can you do to prevent it, what kind of nutrients you need, what kind of diet changes you need, what kind of exercises you need to do, as well as what other contributing factor that can help to prevent such illnesses. And we have gone through also what kind of case studies that can help us to better understand and to incorporate it into our knowledge that we have learned today into action, and we are able to answer majority of the questions that was asked that is based on what we have studied today. So I'm thankful for both of you, as well as your brainstorming ideas for policies and also all the parts that we ask of. And thank you so much for being such collaborative and cooperative participant today. So I hope that we are able to learn a lot, to be able to take home a lot of information and be able to put it into practice in our daily lives so that we can prevent our close ones or people around us or even ourselves from having issues such as these preventable diseases, so that we can always retain the smile on our face with a healthy body, with a healthy mindset. So we would be having a feedback form that we'll be sending to you later. Then from there, you can share with me any feedbacks that you feel that we can improve on how you feel about this session that we have today. And then we will be having our next workshop in regards to healthy lifestyle habits at work, which will be in this coming July. For this session, we will be 9 a.m. to 11 a.m. in location. It's as well as a Zoom meeting. So we look forward to seeing you in participating in our next workshop, where we will be sharing more details in regards to other parts of our lifestyle on how to live a better life. So thank you very much today for your time and for the effort and collaboration that we have together. So thank you very much and have a good day. Thank you.
Thank you. Thank you, Doctor.
See you. Bye-bye.
Bye.
Bye.